So it may seem extra, right? When you go into the plastic surgeon's office and you sign up for surgery and you have to get labs. Like, why do we do that? Well, first and foremost, plastic surgeons are actually doctors. We care about your health status. And it's pretty simple what we usually get. Of course, it may be different in my office compared to someone else, but we usually get a CBC, which has your hemoglobin and hematocrit in there. Also shows us the platelets. These will really indicate, number one, if you have a tendency to bleed. Secondly, where your blood level is before surgery. And the second thing we get is PT and INR, which is more your bleeding time. What is your tendency to bleed? And this is obviously important if you're doing an elective procedure, because you want to look better. Most importantly, we want to make sure that your health is good beforehand, and also that we can maintain that throughout. This is very simple. If you're over 50 and you're having general anesthesia, it's pretty common that we require that you get an EKG. If you have medical problems, and I have to say this again, if you have medical problems, we're probably going to get preoperative clearance. Maybe even get a specialist involved if you need them to give us their input for your surgery. And that might be medication that you're taking, if you have a history of high blood pressure, if you have a history of heart problems, all that kind of stuff. It is so important that you go to a plastic surgeon that can wrap around your health before they do an elective procedure. So yeah, within 30 days is preferable. An EKG can be within the calendar year or within 12 months of the surgery itself. The labs need to be somewhat close to when you do surgery.